People sometimes think that an addiction is psychological.
Correct.
But we're not talking about a psychological addiction here.
No.
We're talking about an addiction that affects a number of structures. It affects the frontal lobe, correct?
Yes.
How so?
Well, any drug that you're putting in your body is changing the chemistry of your brain, which will affect parts of your brain. Frontal lobe is the part that does executive functioning, judgment, insight, impulse control.
Okay, so when these opioids and heroin as well are taken, it changes the efficiency with which you perform cognitive functions. The cerebellum, which involves coordination. This is where she's driving the kids around. It impacts the nucleus accumbens here, which are the pleasure centers, right?
Correct, yes.
And once these brain structures are changed, they're recoded, right?
Absolutely. They don't go back to the way they ever were.
This gets into the limbic system, the basal functions of the brain, which involve the thalamus, the hippocampus, the parts of the brain that involve the emotions, the reasoning, the motivation. All of these things are changed.
They go right out the window.
Do you get what you've done to yourself here? You haven't done this for a week or a month. You've done this for years. When you try to stop and fail, I don't ask myself why you fail. I ask myself why not, because you're not dealing with this at the basal level of the brain. That's what people don't get.
This is amazing to hear, because I started just believing I was screwed up.
Yeah.
Oh, you are. It's just a matter of why. It's just a matter of why you're in that situation. Dr. Johnson, I don't want people, I want to put people on red alert here, but I don't want people to be afraid to take appropriate pain medications when they need them. And I don't want to embarrass Dr. Johnson, but I think he is widely renowned as the finest spinal surgeon in America. He's certainly who I chose to operate on my spine. And the pain was minimal because it was very well done. But if it's needed short term, it's okay to take these, right?
It certainly is. There's not a problem taking them short term. It's really what happens is, Dr. Sophie said, those basal parts of the brain, they have a reprogramming. But you know what, those big yellow parts, that's what we think with. I listened to Carrie, and I think this is might be her new excuse. Okay, it's the basal parts of my brain are going to be reprogrammed. Oh, now I can go back to that. That's going to be her next excuse. Mm-hmm. But it's what's up here. It's in those big yellow parts.
And if you do have a chronic syndrome, Dr. Sachs is a pain specialist, and I've had some pretty serious injuries, and you manage that across time. But my God, you had a matrix set up. It was, you and Nurse Robin back here, seriously, he had a matrix.
Nurse Robin was key.
Yes.
Make sure you knew that.
No question about it. This has to be done very, very carefully if it's a long-term situation, right?
That's correct. Also, the modern understanding is that addiction actually is what we call a biopsychosocial disease, and people have a genetic predilection to get into trouble with these sort of medications. It's far more difficult for you to control it, to decrease your medication use, and to get off these medications at the appropriate time